Hi, my name is Debby Farkas. I'm the Director of Educational Development at WISER. Today I'm speaking with one of our course directors, Dr. Adam Tobias, Assistant Professor of Emergency Medicine at the University of Pittsburgh School of Medicine. Thank you for taking the time to speak with me today.
Thank you for having me.
My pleasure. Can you tell me a little bit about where you got the idea for your course?
Yeah, absolutely. So, one thing that I remember from being a medical student at Pitt was that you spend the first 2 years of your training basically doing basic science and spending a lot of time in the classroom studying, taking exams and things like that. And it's a little bit difficult because you're, very anxious to get out there and start doing actual patient care and see patients and know how to do things. We kind of identified that that was something that even now medical students want early in their training. They want to have some ability to be able to respond to an emergency or to, if they're out in public and something happens, they want to be able to come over and help and have some idea of what they're doing, because even though they're incredibly smart and they've had a lot of training just to get to this level, they really don't have any patient care experience yet. Okay. So we thought that WISER would be a great place to let people practice some of those skills. So we created a course which we called Bystander Emergency Response for medical students to just give them a basic overview of what do you do if you're out in public and you come across an emergency. How do you start the initial steps? How do you interface with emergency medical services? How do you kind of stabilize a patient, even with having limited medical training at this point in your career? So along with one of our senior residents, he and I created this elective where we go through a variety of scenarios and we teach first-year medical students how to respond in these emergencies and what to do. So we thought it filled a gap in, at least in their early training, and addressed a need that they had and something they wanted to do.
I understand that you're a busy academic practicing clinician. Can you tell me how collaborating with WISER was helpful to you?
So WISER was incredibly helpful in the entire process. So even though I've done a lot of teaching in the medical school and with our residency program, this was really the first time that I created an entire course from scratch, and there's a lot that goes into that. So the WISER staff was really helpful in helping me set up the framework for how we wanted to do everything, all of the logistics that go into creating the process. So we had a basic framework for what we wanted to do each week with the students, but actually operationalizing that takes a lot of work and a lot of effort from people that really specialize in this kind of thing. WISER was helpful with going through the curriculum with us and helping us see how we could put this into actual simulation cases and scenarios using the resources in the WISER Center. So it was everything from the actual setup of the scenarios to all of the behind-the-scenes things like setting up our pre-course survey on the website, enrolling everybody on the WISER website, getting any pre-course materials we wanted the students to read ahead of time up there and available to them, creating a course evaluation for them to do after the course, and tracking all of the results of those things. So just the behind-the-scenes setup was a huge part of it. And then the other huge part of it was really the operationalizing of the different cases. So, every session that we did involved a combination of some lecture, which required a classroom and projecting PowerPoint and multimedia presentations, to the actual simulation cases using SimMan and trying to create an environment where it wasn't just the usual cases here, which are, in a hospital room, but rather being out on the street and traffic and being at the scene of a car accident or being out in the wilderness and really making it feel like that's where the students were to make it more realistic for them, which I think worked out great, and they really appreciated feeling like they were in those different environments. And I don't think we could have created that on our own without professional staff and help from WISER.
Great. I'm glad we could help. One of your sessions focused on wilderness medicine. Can you tell me how WISER's operational team made that scenario a reality?
Yeah, so we divided each week into different types of scenarios. So we had, one week was responding to the scene of a car accident that you come across. One was, just responding to things out in public in general. One focused on being on an airplane and, having a medical emergency on an airplane. But we spent an entire session just on wilderness medicine. So really, how do you improvise medical care out in a wilderness setting? And I thought that would be one of the most challenging things to do in a simulation center, because that's really not what things are set up for here.
Right.
So I really had no preconceived notion of what it was going to look like when we came to do that scenario. I thought it would mostly just be the students imagining that we were outside or wherever, and just using their imagination. But actually what happened was they were able to create a wilderness environment here for us. One of our scenarios specifically involved a cave rescue. So the idea was, you're out in the wilderness and somebody gets injured in a cave and falls and dislocates his shoulder, and he's trapped in the cave, and you have to get in there and get him out of the cave and provide medical care for him with limited resources. So, it could have been something simple as just turning out the lights and pretending we were in a cave. But what happened in reality was the specialists at WISER built a cave. And the next thing I know, we're in a room that I've been in many times, but suddenly it was transformed into a cave. And we actually were able to go in there with the students wearing headlamps and crawl into this cave that they built that looked really realistic, and do this closed space rescue with limited mobility, and then we actually did the entire debriefing in the cave. And I think the students really, really felt like they were in this other environment. They weren't in a building in Oakland. And that was one of the things that we got the most positive feedback about, was that cave experience. And so I think next year we're going to do it even better. We're going to get the fog machine, and we'll get some cave noises. But this was fantastic.
Well, thank you for taking the time to speak with me today. I'm glad that we were able to support you in your course development project.
You're welcome.
For more information, please visit WISER's website at www.wiser.pitt.edu.